So it's really about just being reflective on yourself and your experiences, both in the ICU and personally. So this person also got asked, tell us about your shadowing experience. Again, why I stress documentation, because if your shadow experience was years ago and now you're in for your CRNA interview and they want you to describe and explain your shadow experience, you're gonna be like, but if you documented your shadow experience and wrote down everything you learned, your takeaways, all that stuff, you can review that prior to your interview. And you can also submit it as documentation, which I think always looks good, even if they don't require it. So even early on, document your shadowing experience. And I think what's kind of cool about documenting every time is you're going to see your growth.
Well, hello, future CRNA. Welcome back to CRNA School Prep Academy podcast. Today's episode, we are going to bring you our very best CRNA school interview tips. We want to make sure you are acing your CRNA school interview. So the following episodes are going to be oldies but goodies that are going to share with you some of the best knowledge and insights on how to tackle your CRNA interview. So first up is episode number 46, which reveals real CRNA interview questions. And so that way you know what to expect. So if you're looking to listen to the full episode, it is going to be episode number 46. Next, we're going to go into episode 64, which is questions that you should be prepared to ask the interview panel. So again, the full episode is number 64. And last but not least is episode 137, which is more CRNA school interview practice questions. So I hope you guys enjoy this episode. Let's go ahead and get into the show.
You're going to want to save this episode. Today, we are going to cover real interview questions. So this will be a great resource for you when it comes time to studying for your interviews. I'm literally just going to go through real actual questions that the students were asked. So you have a nice little study list to go by. Everyone's afraid of their CRNA interview. And I can tell you right now, everyone thinks they did way worse than what they probably did. We are all our own worst critic. And also want to remind you guys, these schools are not looking for perfection. So again, it doesn't exist. Do the best you can, and that's okay. If you don't know something, try to tell them something you do know around the topic versus saying, I don't know. I'm not saying that you should make something up and completely bluntly lie, but again, if you don't know the answer, say, well, I'm not familiar, or I don't know that, but this is what I do know. This is what I can tell you around that topic. Just so they can kind of gauge where you're at with your knowledge base. Because again, if you just say, I don't know, they have nothing to gauge with, so try to give them something to work with. All right, so let's go ahead and get into it. So number one thing that you will be asked in CRNA interviews is about drugs. Okay, you're going to have to know various drugs down to the cellular level, how they react, receptor sites. So by far, most common thing asked in CRNA interviews is know your ICU drugs, know your vasoactive drips, your sedative drugs, ACLS drugs. Again, all know them down to the cellular level and how they work. So again, this person asked, they're asked about drugs and the receptors down to the cellular level. They got asked about stroke volume. Okay, so knowing the formula for that, Frank Starling's law. And then they got asked about SVO2 and how a pulse ox works, which I probably even know what program this is, but I'm not going to say because it's definitely a favorite question. But how the pulse ox works, look up something called the Beer-Lambert law. Okay, so this website's called howequipmentworks.com. They give a really good description of the Beer-Lambert law. I knew it was something like how something works. So howequipmentworks.com. If you were to visit that site, it does do a really good description on how a pulse ox works and talks about the wavelengths of different light and that type of thing. So check out that website. Also, for those of you guys who are CRNA School Prep Academy students, on our resource page, we have resources for pretty much all of these questions, as well as our learning library covers all of this in detail. So there's no way I have time to cover all of these questions in detail. I'm literally just going to be telling you the questions for you to do your own studying, just for those of you who are not familiar with types of CRNA school questions. All right, another question that was asked is, if I had a warning label, what would it be? That's a unique question and interesting. They also got asked, what is something about me the interview panel might not know? So again, they're kind of digging for a little more information from you than they can get from your resume. And they're just trying to see who you are as a person. So they want something kind of that, again, they wouldn't know otherwise. They wouldn't, don't say, well, I've been a CVICU nurse for 6 years, and prior to nursing, I was a nurse's aide. It's all on your resume. So they want something that they can't find out from the resume. So make sure you're telling them something unique about you. This one person actually was told to take a financial preparedness quiz prior to the interview, which is very interesting. I bet you if that, depending on how that quiz or how that survey shook out, they may ask you about financial preparedness in the interview. This person was asked to describe late versus early signs of sepsis. Tell me about yourself. That's a very common question. So similar to like, what's something about me that the interview panel might not know. So kind of a different way to ask me or ask you, tell me about yourself kind of thing. I've had students ask me, well, should I talk about work-related things as far as tell me about myself and highlight my accomplishments on my resume, or should I make it all personal? And this is really just, that's up to you. There's no right or wrong answer for that. Just make sure if you do make it about work that you really are kind of summarizing and highlighting the main points versus regurgitating your resume. If I had to pick, and again, I can't speak for all the programs, I kind of like personal tell me about yourself, because again, I can get other things from your resume. But if you had some kind of major accomplishment, like a Daisy Award or something like that, I don't know, maybe tell the backstory about the Daisy Award. I don't know, maybe just something like that to highlight on your resume, and maybe something about you that makes you who you are as a person that allowed you to get that award professionally. You know what I mean? So you can still kind of blend personal and work together for that question. If you have considered advanced practice nursing professions, how have you prepared? Or have you considered other advanced practice nurse roles? So that's interesting. So yeah, they might ask you, have you considered becoming an acute care NP or any kind of other acute care NPs, and why? And then maybe even like what brought you back to CRNA? They asked this person again, how have they prepared up to this point for CRNA school? And so this is really important to actually have been actively doing things. This is why I kind of preach all the time that you should be preparing for CRNA school from the time you decide you want to do it, from the time you step in the ICU. It really should be a very long road ahead of you, being part of CRNA School Prep Academy, going to conferences, doing what you can to get involved in the community, and really just understanding and knowing what this profession is all about, shadowing CRNAs. So again, they're looking for how invested are you in your career path to becoming a CRNA? How do you deal with stress? That's a really good question, because you're going to be really stressed out in school. And one of my previous episodes, I talked about mental, or not even mental, but just overall wellness plan, having a wellness plan. You need to have a wellness plan. Okay. You need to know how you're going to deal with your stress. And I really think it starts from having a good habit on doing this, almost to do it daily, to handle your stress daily. If you have good coping mechanisms to handle your daily stress, you're going to be okay in CRNA school. So they're going to pry, they're going to ask you these things. So again, having that plan and knowing how to speak to that plan too. Like, this is what I do to cope with my current stress. This is how I think it's going to help me in CRNA school. This person also got asked, have you prepared financially? So very important too. I think in the last episode we did, I also covered one of the first things you should do when you gain acceptance to school is to, you should be doing this prior to actually, but one of the first things you should really hone in on is your financial readiness. Once you do gain acceptance, kind of get everything in order, tell us about a failure in your life and how you overcame it. That's, I think people have a hard time thinking about when they failed. And I know if you're like me, sometimes when something negative happens, it must be a protective mechanism, but like, I kind of black that out. Like I kind of don't hone in on it. I don't dwell on it, I guess. And so over a period of time, I tend to forget those things, or I don't remember them in great detail. Now, don't get me wrong. I could definitely speak of some bigger failures, but I think it's important to start thinking about that now, so you have the details. Because I could probably tell you what I failed at, but could I tell you all the details? Not unless I've really probably dwelled and focused on it. And I don't know if that's a bad thing or good thing. I'm just saying, I know that's how I am. Meaning if something happens to me that's kind of not good, I tend to try not to put too much focus on it. I try to just keep moving forward from it. And so when I'm asked about the details of it later, I'm like, I don't know, but this is how it turned out and I'm okay now, So anyhow, just something to think about. I mean, we obviously all learn from our failures, right? That's part of what it is, but remembering the details of the failure and the actionable steps you took to overcome it is what sometimes can get a little muddy over time. Okay. So talk about a conflict where you got criticism from a coworker. Ooh, that's a good one. And has that ever happened? Like, do you even know about it? Part of me thinks like, if I had a coworker say something about me, I don't even know if they'd be man enough to tell me to my face, I mean, I'm sure people have said stuff about me behind my back. But have you done something where someone actually has confronted you on it? And remembering that, because same thing, like, I would even have a hard time thinking on the spot what that would be. I remember one time I got mad at a coworker who left out of order, meaning like I was due to leave at 3:30. It was 5:30 at night and she was at 5:30 and she left at 5:20 p.m. and left me in a room to finish my case. I was really angry about that. And I confronted her and then we got into this little riff. We're fine now, but I mean, she was mad at me for being mad at her at that, so anyways, and personally, she was in the wrong. So anyhow, I'm still sticking to that story. Anyhow, so yeah, thinking about those things ahead of time will make it much easier to speak to it on the spot, right? Especially when you're nervous. And me personally, I don't know you guys, like I had 2 CRNA interviews. I have a way harder time with personal questions than I do like black and white questions. Cause for me, it's easy to study black and white stuff and be able to kind of like understand it. The personal questions, again, I'd have to put a lot of effort into having a good game plan in my mind on what I would say. So it's really about just being reflective on yourself and your experiences, both in the ICU and personally. So this person also got asked, tell us about your shadowing experience. Again, why I stress documentation, because if your shadow experience was years ago, and now you're in for your CRNA interview and they want you to describe and explain your shadow experience, you're gonna be like, but if you documented your shadow experience and wrote down everything you learned, your takeaways, all that stuff, you can review that prior to your interview. And you can also submit it as documentation, which I think always looks good, even if they don't require it. So even early on, document your shadowing experience. And I think what's kind of cool about documenting every time is you're going to see your growth. You're going to see, oh, wow, when I first shadowed, this was my takeaway. And it was so like maybe laser focused on a couple things. And now that I've done it several times, my takeaways are a much bigger picture takeaway. So I think that'd be kind of cool to see. And you can report that too when they ask you about this question. Well, I've documented every single shadow experience. And these are my big takeaways when I compare my first and my last shadow experience. That would be a really cool way to answer that question. I think that'd be impressive. This person got asked about hemovolemic shock, but down to like the body's compensation, such as the RAS system, which is the renin-angiotensin system. So understanding that, so very, very detailed. This person, again, medications and receptors they acted on. So I already touched on that. Definitely pretty much a given that you're going to be asked about drugs and how they affect. And so ICU drugs, ACLS drugs, sedation drugs, pain medication, those are the really big ones. But they could even ask you about like, Clonidine. I mean, it is a sedative drug, but Clonidine, I even have heard about Pepsid and different histamine blockers being asked about too. So not just vasoactive drugs, understanding, just any medications you're giving, you should understand how they work. That's kind of like what it kind of comes down to. It's hard to really say. I mean, there's so much to know, but that's why if you take it day by day, little by little, while you're gaining the 1 to 2 years of ICU experience, it's not going to feel super overwhelming. If you wait till like 2 weeks before the interview and you're like, I have all these drugs to study. Okay, it's going to be super overwhelming and you're probably not going to be able to just know everything that quickly. But over time, if you quiz yourself over time, when you're working in ICU, you're going to see that drug more than once. And so the next time you see it, it'll jog your memory of what you've already studied. You'll study it again because you'll remember it. And so it'll be reinforced over time. And then it's not going to feel super overwhelming to be asked about in the interview. So please take my advice and do that.
A daily dose of inspiration from a CRNA School Prep Academy student. I have been waiting to write this post for a few years now, 3 to be exact. I finally got accepted to CRNA school. Thank you so much to CSPA for everything. I have been a member for 3 years and went to 2 conferences, which was super helpful. I also did 2 mock interviews. I then did the 5-day interview boot camp 3 separate times as well. Here's my story. This has been a lifelong dream of mine since I was 13 years old. My GPA was a 3.2, so not the best, and I refused to take the GRE because I don't feel standardized tests should be used to determine the quality level of a student. I worked at a busy level 1 trauma center for 6 years and was a part of every committee possible. I also had my CCRN, my TNCC. I was charge nurse and a preceptor. I took grad level biochemistry course from Oregon State as well. I applied to over 7 different schools and only got 2 interviews. Rejection was not fun over and over again, and after a failed interview in January, I almost gave up. CSPA helped me so much and gave me the motivation to keep pursuing my dreams. Moral of the story, do not give up. I just love this story so very much. So dear future CRNA, you know who you are. Congratulations. I'm so incredibly proud of you. If you're not already subscribed to our free Future CRNA newsletter, be sure to do so now. Pause this episode and click the link in the show notes or comments below. Cheers to your future. Now back to the show. So today we're going to cover what are some questions that you should be asking the interview panel after your interview. So as you may know, CSPA has 2 expert contributors now, Richard Wilson and Don Abushan, who has a program director experience. Richard has assistant program experience, both well over 10 years. And so they come to CSPA with a lot of insight over the last decade on guiding students to get into their programs and how to make them competitive candidates. So I recently posed this question because I get asked this a lot, and today I'm going to share with some insight from them on what they like to get from students during the CRNA school interview as far as questions at the end. Now, I also want to start this off with saying that you should have a question for the interview panel. I have heard program faculty say that, they get to the very end of the interview, it might have been a really good interview, and then they ask their student who are the interviewee if they have any questions for them, and they say no. And it kind of just leaves them feeling like, come on, I want you to have something to ask me. So you should have at least one question. Now, you don't want to have a laundry list. I would encourage you to pick 1 or 2 questions, maybe a 3rd question, but for the most part, I think 2 is probably where I think most students should call it quits, because again, they usually are on a time requirement to interview you, and they just don't have time to answer 5 or 6 or 10 questions. You also want to be very, very careful that you're not asking questions that you can easily find out through visiting their website. This is a big red flag for a lot of programs that just shows that you didn't do your due diligence and really thoroughly read through their program and what their program's all about. There are also a lot of schools who will kind of do what I call kind of a meet and greet prior to the interview, where you mix and mingle with students, and the program faculty actually introduce the program and hit a lot of questions that students typically have about their program. So this tends to make it kind of tricky, because then you may have had a question prepared, but if they went over that during that time, you clearly don't want to be asking that question, because then it just shows that you didn't listen, right? And also sometimes programs do that on purpose to cut down on how many questions students have for them, because like I said, they typically maybe have 1 or 2 questions tops that you can ask them during the time frame that they have to interview. So either way, I asked for guidance from both Richard and Don to see what they had to say about students asking questions at the end of the interview. So some of the questions that were recommended are turnover rate for faculty, which I found very interesting. I personally would never have thought to ask that question. But the reason why I think this question is really good is because if they have had a high turnover rate for faculty, and I hate to say this, but a lot of programs do, it could indicate some instability or potentially, how can I say this? If they have all this new faculty, it could make your time as a student even a little more challenging, is probably a good way to put it, because they're going to have some kinks to work out. And I myself, when I was in school, we had a program director retire. We had a new assistant director and that also taught class. And I remember she came in with nothing, like she didn't have notes, she didn't have anything to go by because the previous professor would just really talk off the cuff and didn't really necessarily have a lot of prepared notes. And so this newer person kind of struggled during the time that we came into her course. And I know she worked her so hard and she did a great job, but was it a little intermittently kind of challenging? Yeah, it was. So it made for a transition that kind of reflected a little more challenge on us, the student body. So while at the end of the day, we all did great, we all went on to become CRNAs, it was fine. It is something to kind of consider and think about if they have a high turnover rate in faculty, and that could signal potential and some instability. And why is that? And that's what, essentially was said, that can indicate stability of a program. If they have had long-standing faculty members, that's a really good indication that the program is very stable. Like I said, the program that I went to, the director retired after, I don't know how many years, probably well over 15, 20 years. It was a very long time. And even now, I mean, for the most part, that program over the last 40 years has only been run by 2 people, which is amazing. So I think that's a good thing, right? So also suggested, what does your faculty enjoy most about the program? Which I think is really interesting. It kind of lets them give their own personal opinion, which I think is a great question to ask because it's not something, again, that you can find on their website. So again, what do they enjoy the most about their program, which will allow you to find out something maybe a little more unique that maybe only insiders would know about, for example. Another question, support or encouragement. Do they support or encourage students to attend professional events through the AANA, state associations, those types of things? I think that's really key too, because I mean, some schools are really, really proactive with it and really make sure they get their students involved. And other programs, it's optional, it's there, but essentially it's a little more on the students to take initiative to do it versus the programs really saying you need to go do this kind of thing. So it just would be, based on your own values, based on what you want out of your education. I think that's a great question to ask. Another question is, what are the 2 most common reasons for attrition in your program? I think that's really awesome as well, because it allows them to say, instead of saying, can you explain your attrition rate? You could say, what are the 2 most common reasons for your attrition rate? And yes, you guys, some schools have a significantly high attrition rate. Some schools that I know of have 35%. I mean, that's very, very high. And some schools historically have a low attrition rate, like maybe less than 10%. And then all of a sudden 1 year, boom, they have, 30%. So what happened, right? It leaves you wondering. Now, it's not always a bad thing on the school, so don't read into it. Don't not apply to a school just because they have a high attrition rate. There could be a very good reason for that. I know, like with the year that, 2020 was quite a year, right? That year's programs had almost all programs across the board had a little bit higher attrition rate. But is it at the fault of the programs? No. I mean, granted, there was a lot of things going on, like transitioning to virtual, and sure, that was an added challenge and stressor on the student body, but it could have also been, the students having personal problems as well with everything going on that year. So it's not always a negative reflection on the program, but it could indicate such. So it's kind of important to kind of say, well, what are the 2 most common reasons that you feel like your attrition rate is 30% or whatever it is, 20%? And see what they say. Sometimes you literally have students, you guys, who get into CRNA school who decide that it's not for them. And that's no fault of the program. If anything, that's why you need to shadow a CRNA. Because I can't imagine getting into schooling and deciding, this is not what I want to do. So that does happen. Or I've had students who maybe have had like medical problems, right? Or who got diagnosed with cancer, or now have this major medical thing looming over them, or they decided to take a year off so they could start a family, or they did start a family and they decided to drop out. Whatever the reason is, it may not be anything wrong with the program. So I think it's an important question to ask. And I also want to share with you guys that down below you can grab another really amazing freebie. This one actually is different because it's CRNA School interview questions, but it's a study guide. So it's essentially answered interview questions, clinical interview questions And it's a study guide that you guys can download. So make sure you grab that free resource down below. It's going to really, really help in your preparation for the interviews. But again, it's just clinical related questions. It's about 120 clinical questions that are all answered for you. So make sure you grab that freebie. Another question that is suggested for the interview panel, and Dr. Abushan says she likes creative questions, which I think is really cool, and ask about how the program encourages wellness for their students and residents. So yeah, I think this is a really great question because, well, first, wellness is really at the priority of what schools are realizing their students really need. I mean, like I said, 2020 was a hard year. I think it kind of unraveled a lot of weak points in CRNA schooling. And a lot of that stems from not allowing students to really focus on their own wellness, or not having students really prepared to focus on their wellness. Like I mentioned in other episodes, that's a really, really a vital step to making sure that you know what you need, and making sure you're still doing those things despite being really busy. But what are the schools doing to encourage wellness for their students? So I think it's kind of cool to know if they have, like, maybe they have some certain programs. Some programs even have free counselors that you can go to. So might be kind of a cool way to find that out. Do they have a wellness leader for each cohort that plans wellness events for the students' residents? I think that's really cool too, because that's not very common, I would say, to have a program have a focus on having a wellness leader within their program. I think that's a really great idea. And so it's a really cool thing to bring up and ask about. Because even if they don't, if you were to ask that question, then be like, oh, we don't, but that's a really great idea, right? And then then you maybe take the lead for that. You can come in their program and you can be the wellness leader. You see how you can kind of spin that a little bit? You can share that you're really passionate about that and how you would love to help that kind of program exist in their program.
And I want to wish you the best of luck on your upcoming interview. I know you're probably like, Jenny, I'm freaking out. Totally get it. But congratulations, because the fact that you got an interview means that you're qualified for acceptance. They saw potential in you. So you have to now believe in your own potential. So try to get the mindset right. And, look at it as this is an opportunity for to learn and grow, to see what this is like. All CRNA schools are a little different as far as the style of interview. Not all schools will even ask you clinical style interview questions. So if that is you, while I still think this episode is going to be incredibly valuable, especially long term, as you start your CRNA journey, know that not all schools are going to ask you pathophysiology pharmacology questions. And so while I think you should not neglect that knowledge base, because there's always a potential, I do think, you should understand the style you're getting ready to go into. And if they're going to ask you more personal questions, maybe at the end, I can cover some common personal questions and just different tidbits on how to answer those. I'll just wing it because I don't have that in the study guide. But again, I don't want to leave you out if you're going to be having, or if you're getting ready to experience a very heavy personal interview. So at the end of the episode, again, I'll cover some common personal questions that you may get asked and just some of the different variations and personal questions that I have heard throughout the years of mentoring students. So without further ado, let's go ahead and get into it. All right. So first, we are going to cover the question, please explain the difference between SaO2 and PaO2. So the SaO2 is the percentage of hemoglobin binding sites that are occupied with O2, oxygen. The PaO2 is the pressure exerted by the oxygen, O2, on the arterial wall. So your PaO2, or your pressure, is measured in millimeters of mercury. All right. And the adult normal is within a range of 80 to 100. So the normal PaO2 in an adult is 80 to 100 millimeters of mercury. I want to emphasize the unit of measurement, millimeters of mercury, because if you just start rambling, if they ask you some type of clinical question and you rattle out a number, they may come back and say, in what unit of measurement? And if you haven't quite paid attention to that, you could be like, oh, darn it. I knew the number, but I didn't remember the unit of measurement. So again, to have a fully correct answer, you need to remember the unit of measurement. All right. So the PO2 again is measured as millimeters of mercury. Normal is 80 to 100 millimeters of mercury, and the SaO2 is measured as a percentage. The normal adult percentage is right around 90 to 100% SaO2. The PaO2 requires an arterial blood sample, while an SaO2 can be acquired by placing a non-invasive sensor on the skin, aka the pulse oximeter. So note here that oxygen saturation, the SaO2, does not differentiate between oxygen or carbon monoxide, as they both bind to hemoglobin. So again, you can have carbon monoxide poisoning, and on your pulse oximeter, you could be registering 100% O2. And you're like, oh, I don't know why you look so blue, sir. But just know that unfortunately the pulse oximeter doesn't differentiate between the two. That could be a little curveball they throw you potentially. All right, so let's move on to the next question. What is the difference between hypoxia and hypoxemia? All right, so hypoxia the definition of hypoxia is low levels of oxygen in body tissues. So I'm going to say that again, hypoxia is low levels of oxygen in the body tissues, where hypoxemia, the emia means blood. So hypoxemia means low levels of oxygen in the blood. So again, relatively basic, but the emia is really the differentiating factor that really can maybe trigger your brain to kind of differentiate the two. All right, we're moving on. Go ahead and tell me about the pathophysiology of ARDS, which is the adult respiratory distress syndrome. So ARDS is actually very complicated, and there's actually probably more to it on here, but I kind of explain it in 3 stages to make it easier. Now keep in mind, if they ask you about ARDS, this could lead into then explain sepsis, right? Because again, they kind of go hand in hand, but ARDS is a special type of sepsis, right? So just make sure you're differentiating between the two and not blending them together. And if they have you explain the difference, be able to do so. But let's go into the 3 stages of ARDS, which is exudative, which is essentially damage to the alveolar epithelium and the vascular endothelium, which causes it to produce leakage of water. Okay, so your lungs can then fill with that leakage. So the leakage of water, it also leaks protein and different inflammatory mediators, red blood cells, again, into the interstitium and the alveolar lumen. So kind of filling your alveolar sacs with fluid and different types of inflammatory mediators, red blood cells, protein, etc. Type 1 alveolar cells are irreversibly damaged, and that space is replaced by the deposition of the proteins, fibrin and cellular debris, producing hyaline membranes, while injury to the surfactant producing type 2 cells contributes to alveolar collapse. So there's 2 different types of damage going on. They're damaging type 1 alveolar cells, which are irreversibly damaged. And again, that space is then replaced by, the proteins, the fibrin, cellular debris. And again, there's also injury to the surfactant producing type 2 cells, which then cause the alveolar to collapse. So you may know surfactant in infants. That's why preemie babies get steroids to try to start producing that surfactant, because otherwise their lungs very easily collapse and they get really severe atelectasis, and there's pneumonia and things of that nature that can, and obviously hypoxia and things of that nature that can happen from atelectasis. So again, ARDS is a situation where that is actually occurring, and not only are you filling up the alveolar with, again, the fluid and different types of inflammatory mediators, but you're also damaging the type 2 surfactant producing cells, which then unfortunately allows the alveolar to just easily collapse and not remain open. So patients who have ARDS, you'll see them on very high levels of PEEP to try to combat the lack of surfactant and the collapse of the alveolar cells. All right, then that's the exudative phase. Then you have the proliferative phase, which is again where the type 2 cells proliferate with some epithelial cell regeneration, which kind of can cause a fibroblastic reaction and remodeling. So, and then you have the very last, the third stage, which is fibrotic, which involves collagen deposition in the alveolar vascular and interstitial beds with development of microcysts. So kind of really painting a really grim picture here, but it just kind of self-festers into being a very damaging process to your lungs, where very little healthy lung is left, if any. And it's incredibly hard to get a patient to recover from this because it kind of creates this really vicious cycle that just severely damages the cells to the point where they're of no return. So those are the 3 stages of ARDS. Obviously, ARDS, the sooner you intervene and correct the underlying cause, the better the outcome will be. If you get to the state, second and third phase, there's not, the outcomes are probably going to be relatively poor. Okay, so what are some optimal vent settings then for ARDS, they may ask? Well, low tidal volume, between 4 to 6 mLs per kilo to prevent like barotrauma or volume trauma. So again, your alveolars or the alveoli are really sensitive because they're already maxed with like pus and fluid, and their surfactants damaged. They don't have much elasticity anymore. So if you're blowing large tidal volumes in there, you're just going to further damage the cells with like barotrauma. They're very sensitive to that. So they typically do low volume, and again, keep their airway pressures low because they're going to be unnaturally high because again of the alveolar, again, having the lack of surfactant and being full of fluid and things of that nature. You want to really watch your plateau pressures. You always want to try to aim to keep that below 30 centimeters of water. So again, you want, low tidal volumes, probably higher respiratory rates, and you want to really watch your airway pressures to keep your plateau pressure under 30 centimeters of water. All right, so that is ARDS. And again, keep in mind they could lead into sepsis from there. And again, the pathophysiology of sepsis is pretty complicated, but I do go into that in some of the next questions. Well, that's all for today, future CRNA. I hope you enjoyed our interview prep tools for you. And just as a reminder, in case you want to go back and listen to the full episode, if you want more real CRNA school interview questions, be sure to check out episode number 46. If you're looking for more help with what questions to ask your interview panel, you can go back to episode number 64 for the full episode. And if you're just looking for more CRNA interview practice questions, be sure to listen to the full episode 137. All right, well, that's all for today. Until next time, take care. Hey, future CRNA, as always, I appreciate you and your loyalty. Thank you so very much for tuning in this week. I'd love to hear from you, so screenshot this episode and share it to your IG stories with your biggest takeaway. Don't forget to tag me at CRNA School Prep Academy so I can personally thank you. Be sure to head over to CRNASchoolPrepAcademy.com to check out our blog and gather free resources to help you along your CRNA journey. Stay strong, and I'll see you next week.